So thanks everybody for joining us for the CPEN Engagement Lounge on COVID-19 and reopening your resource center. Before we get started, I just wanted to go over a few housekeeping notes. Unless you're speaking, please keep yourself on mute just to limit background noise. Again, you're invited to share your camera so that we could see everybody. Use a headset if you can, again, just to try to limit background noise if possible. If you have a comment or a question or you want to speak, please use the raise your hand feature, which is under the participant menu. If you click on participants, you can see that. And that way our moderators can call on you to speak out loud. You're also welcome if you feel more comfortable asking questions or commenting in the chat. And that is perfectly fine. If you need technical assistance, please use the chat function for that. And then statements expressed by the moderators or any attendees are those of the participants individually and do not necessarily represent the opinion or position of the Cancer Patient Education Network. And finally, this event is being recorded. If you do not wish to be recorded, please do not raise your hand to speak. And before we begin our discussion, Janet Papadakos, the 2020 CPEN chair, would like to say a few words about CPEN.
Great. Well, thank you very much, Allison, and welcome everybody to the second CPEN Engagement Lounge that we have had dedicated to topics related to COVID-19. We wanted to, we know that there are a great number of participants on this event. There are over, it looks like 94 right now. And CPEN is a very small organization. So we know a lot of participants today are not yet members of CPEN. And we decided to open up the engagement lounges beyond our membership because we know these topics are so important. And we also thought it might be a nice opportunity to get to know you or for you to get to know our organization. And so, although there is zero obligation, we did want to encourage you to consider becoming a member of CPEN. You can see from these photos, there are a number of excellent reasons to join. There are great opportunities for collaboration, for learning best practices, for networking, for meeting the leaders of patient education at top cancer centers throughout the world. And so it's a really great opportunity to connect with people, your people who are struggling with the same challenges and who can really help you. And we do belong to a very small field, but when you're part of CPEN, it doesn't feel so small. And I'll just also add that, you know, even though this is an organization dedicated to cancer patient education has a lot of similarities and overlap with patient education for any disease. And we have a lot of members who are not just working in cancer education. We have a number of people in other fields as well. So I did want to share that with you and encourage you to check out CPEN. You are welcome to reach out to me, Janet Papadakos. If you have any questions about CPEN, about becoming a member, about what membership means to you. So please do feel free to do that. And without any further hold up, I think we'll just jump right in and I think Megan and Nikki will introduce themselves.
Hello, everybody. This is Megan Battaglia. I am the manager of the Patient Education Department at Roswell Park Comprehensive Cancer Center, and our Patient Education Department also includes our Resource Center for Patients and Families. And I have a few members of the Resource Center and the rest of our team on the call today as well. So thank you all for coming.
Hi, everyone. I'm Niki Vossberg. I am one of the health educators in the Cancer Learning Center at Huntsman Cancer Institute here in Salt Lake City, Utah. And like Megan, there are a few people from the department I work in joining on this call as well.
Okay, so we wanted to, again, thank you all for joining us today. I know we're all feeling the same challenges and opportunities for reopening our resource centers after the shutdown. We've been working on kind of a phased plan here at Roswell Park, and our resource center also includes a wig and hat program where people come in and choose their wigs. We have stylists come in who cut the wigs, sometimes cut the patient's hair. So that's presenting an additional challenge for us, how to keep safe and social distancing while people are trying to choose wigs for themselves. So we've had to incorporate that into our phased plans. It also includes trying to deal with our volunteers when it's safe for them to return. And also we used to have massage therapists coming in. That's presenting another challenge. And we do have a kind of a small space. So we're very interested in hearing if anybody would like to share if they have opened already, if they're planning to open, and some of the challenges and some of the plans that you've put into place and how it's working. So would anybody like to share their experiences so far? Can I ask if anybody has reopened their resource center? Nobody yet? Okay. We're actually planning, we're here in New York State, so we're also following the kind of the rules and regulations that the state has put out, as well as the CDC and as well as our infection control and COVID team here. So we're actually planning to open on June 8th. We're going to be obviously requiring masks, hand sanitizing, sanitizing surfaces, and we're going to try a contactless wig appointments where patients will be choosing their wigs, seeing wigs on a mannequin and choosing them from there. We're also have been dealing with trying to figure out how to share materials with patients, taking that away from kind of the self-service to patients not handling the materials that only be handled by resource center staff. So is anybody else coming up with plans such as this? Niki, do you have any plans at Huntsman? Any dates for opening yet?
Nothing is set yet. The conversations have definitely started. We're probably looking to softly reopen our learning center in the next 2 to 3 weeks. We're still ironing out a lot of the details and the policies and our procedures. We're looking at, so our department houses our learning center, which is staffed by our health educators. And then also we have our outreach department in our space as well, part of our department, and our patient navigators. And so we're trying to determine how to safely have a representative for each of those compartments of our department available on site once the hospital does open up to visitors and whatnot. We're thinking about probably just having one person in for the day to handle any inquiries that come in that need assistance in our physical learning center space. And we're really trying to figure out what's the safest way to do that. So I know I'm really curious to hear if other centers have been looking into that, and if other people have come up with ways to kind of adjust to keep everybody safe. And it looks like we have somebody. Paul, would you like to jump in here and
yes, thank you. It's great to kind of touch base and see what other people are doing. I work at the University of California, San Francisco, UCSF, and I'm a senior program manager with the Cancer Support Center. We're kind of just regulated by the overall university. We don't particularly have any say in, whether we reopen or not. So that's the first thing. But what our university is doing, they're ramping up. They want full patients scheduled by June 1st. They want surgeries, clinical appointments, everything. Of course, it's a new normal with masks, staggered appointment times. Not everyone will come in on the hour, for example. but they still want non-essential personnel, which were considered non-essential, to stay working from home. And I think they're just winging it. I don't think they have a grand plan of when to get that going. I think they want to see how the clinical operations will work. In the meantime, we have a great manager who's gotten so many of our support groups online, our meditation classes online, even our exercise classes are online. And I think, you know, we're kind of justifying our existence in a certain way, but we're also attracting new people to our services that hadn't used them before. And that's kind of our state right now.
I think Paul has brought up a really good point that we've worked with, and actually we were quite pleased we were able to do it. We had to think outside the box since people couldn't come in and we couldn't interact with them one-on-one. In the beginning, we tried to figure out how can we continue to serve our patients and take care of them virtually. And we have been able to do that. They're calling in, we're returning their phone calls, we're sending them information, we're sending them referrals to other departments to get their questions answered or get the help that they need. And we actually have been sending out our wig catalogs and having them access it online, choosing a wig and a color, and we just send it to them from home because we didn't want to stop that service as well. So as Paul pointed out, I think it's people had to think outside the box and had to figure out how can we still take care of our patients and do it virtually and make us as accessible as we could. Another thing, we used to do chemotherapy orientations in our resource center, which again we had to stop. So at the same time we were creating a video. So we've just about finished the video. So now we're going to be directing patients to watch this video on YouTube and then call us to have a discussion or a more personal discussion. So has anybody else come up with any interesting or unique ways to work with your patients virtually?
This is Sarah Christensen, MD Anderson Cancer Center. I actually have a question for Paul. So how are you letting your patrons know about your new virtual services?
Our biggest form of communication is our monthly newsletter. And so we have about 3,000 people that receive it, but about 20% actually click on it. And, you know, we do our best to just let our staff know. There's sometimes, because we're such a big, well, I've been there 15 years, and I say we've gone from being a large hospital to being a large bureaucracy. So ironically, even though our services have expanded, sometimes our staff don't always know what we do. So that's like a hurdle that we try to get our staff to know, because most of our patients know about us through word of mouth. But those two things, our newsletter and then letting staff know. And then also, this might be interesting to this group. And by the way, I don't know why I haven't joined this group so far, but that's going to be the next thing I'm going to do. But because we've become so big, a couple of years ago, I, along with some other colleagues, started a cancer supportive care committee where we invite everybody in the cancer center, frontline, doctors, anybody who wants to come. And then we have like a specialist who will speak each month about supportive care. And ideally, those people will go back to their departments and talk about, you know, what's available to patients. And, you know, we haven't gotten tons of people coming to it, but we found people like we would never think, like a nurse practitioner in endocrine has now become a champion of supportive care in her department. And so they count on her to go to the meetings and report back. So that's another way we let our staff know what we're doing.
Looks like Lisa Horton has raised her hand. Lisa?
Hi, everybody. Yes, I just wanted to mention that the Seattle Cancer Care Alliance has been able to keep our resource center open. And by open, I mean we've changed a lot of our services. We work with our infection prevention team. Our library is closed, so we no longer do the lending library. We have suspended the wig fittings, although one of our coordinators that's there, health educators, has done a couple of virtual wig fitting, similar to what somebody else mentioned earlier, where photographs were taken of the wig and preferences, and we were able to send out a wig, and that was very well received. And so again, it's just the bandwidth. We had one of our health educators out on maternity leave, so our hours are much reduced, but we do have, per infection prevention, we can only have people in there when there is a staff, resource center staff present, because each of the computer workstations has to be cleaned after each use. The health educator that's there, who's also on this call, she does monitor social distancing within the resource center, but we are able to be there to help patients, to help triage them through our system, refer them to community resources. And we are also looking at ways to virtually help our folks, but we're not quite that far along. We're trying to enhance our web page on our public-facing web page so that patients can have access to more documents than are up there now. So it's all a new normal. We're going to start increasing our hours a little bit more next week as one of our educators is coming back off of maternity leave. So again, and we also don't allow anybody, of course, just to touch booklets, that they have to go through the health educators to get the information. So we have those kind of sanctioned off, and with signage saying that they, to ask the health educator for information.
Lisa, thank you. That was good information. I also see Nina Galpern has her hand raised. Nina?
Yes, hi, everyone. I'm Nina, Fox Chase Cancer Center, Philadelphia. I know I talked to some of you through email, asking what some of your centers were doing, and I appreciate your responses. So far I've heard from about 5 or 6 of you, and the plans are still evolving. A lot of responses I got say a phased approach. At Fox Chase, because we're in the Philadelphia area, we're still under a stay-at-home order, and that's due to expire next Friday, I believe. But that doesn't mean everybody's going to be rushing back into work. The issue with our resource center is we're not in a separate room. We're literally in a hallway of the outpatient area. So it's wide open. So on March 13th, we had to remove everything. So there's no publications out at all. We have a lot of touchy surfaces like the phone chargers and the computers. We had to cover up all those areas. And so the issues are everything at the rec, the resource center that we operate, is a touch surface. So we don't know what we're going to do about the publications and the phone charging station where everybody puts a code in, and the public computers, and things like the coffee machine that we have there. I mean, basically everything we have in person involves people touching things. So in the meantime, while that's been closed, we have to deal with those issues. We don't know how we're going to resolve them yet. We have kept our resource center running remotely by operating our patient-to-patient network. So our calls have actually increased lately, getting calls for people that need support peer-to-peer. We've taken calls on our resource center line. Those calls are forwarded and continue to serve as many as we can. But opening is going to be a challenge because we're a wide open area, and that's what I was looking to get some feedback from some of you on. What do you do? We don't have a door that we can close. We don't really have the space where we can store the materials to hand them out. So how do we stop people from just taking them? So these are all issues that I know we're going to have to work out, and I don't know when we're returning. That hasn't been decided. So anything anybody can help with, I appreciate. Thank you.
There actually, I've been on the group chat here. There has been an awful lot of questions. I think, Nina, other people are also struggling with the idea of how do you handle these pamphlets and the things that people touch, the paper and the books, the loans and the pamphlets. So some of the parts of the chat, it says Dana Farber is having remote workshops. Somebody else has removed brochures from at Moffitt. They removed all the pamphlets in the clinics, and the patient libraries and resource centers are still closed. Somebody else also mentioned that they're working closely with infection control to establish guidelines. So actually, it's kind of a question I want to put out as well. There's so many rules and guidelines coming at us. So at least here at Roswell, we've got New York State rules, we've got the CDC rules, and we've got our own COVID team and our infection control department that are also kind of helping guide us. Is anybody also struggling with government versus inside their institute? Is there a lot of any states not open yet, or any states getting in the way of things that you want to do? Does anybody have any comments on that?
I would say here at Huntsman in Utah, we're being more conservative than the state. So as the state reopens, we're kind of lagging behind in terms of softening our visitor policy at the hospital, and reopening our physical learning center space. We're still providing services remotely, but the state is kind of leading the reopening phases, and we're just kind of lagging behind a bit to see how it goes. We don't want to rush into anything, especially considering our patient population.
And Nikki, that's exactly how we feel. We're kind of a week or two behind what New York State is putting out in their phased plan. Again, it's because our patients are a unique population, so we would rather lag behind and keep things safe than try to jump the gun a little bit. I've noticed there's something in the chat from Ruth Barker. I'm sorry. She mentions in one of the chats that they're doing remote or online chemo classes, and I wanted to ask her if she could share a little more about that, because we're struggling with how we can continue to do our chemo orientation in the resource center when we can't ask them to come in. So is Ruth Barker still on the call? Is there anything you could share with us, Ruth? No. Okay. Can I ask? Does anybody?
Sorry, I just had to unmute.
Oh, hello.
I had to find the unmute first. We had our patient educator, or their nursing educator, and myself. We went through the slide deck that we normally have with our face-to-face class, and modified it for an online video. It's not perfect, it's a little long, but I think it's got all of the main points there. Our biggest problem was actually getting our communications group to get it up onto our site. That took about 6 weeks. It took longer to get it onto our site than it did to actually get the video done. So we've just started.
I can relate to that, Ruth.
So we just started, so we'll see how it goes. But it's actually opened the door for us to start thinking about many other opportunities for online education that we would like to do.
And how are you letting the patients know how to get to the video, or is it still too new? How are you directing them?
We're actually going to give them a little flyer, and we're also going to put a flyer up where they check in for all of the online courses and support groups and all those types of things, because we don't have anything face-to-face in the cancer center anymore.
Thank you for that, Ruth. I think it's something that we're all looking at for many different reasons. Because again, with our chemo orientations, we can no longer have that many people in our resource center. We can't be within 6 feet of them. And I'm a little skeptical of having classes just yet until we feel a little further away from this. So I think we are, our videos from Roswell Park, our patient ed videos go on YouTube. And we felt that's the easiest way for people to get to them. Everybody's pretty familiar with YouTube, and they don't need any special software or anything in particular. It's just go onto the internet, get to YouTube, and watch the video from there. So we're hoping that works. We're rolling that out soon. Anybody else have want to share any experiences they have, or any questions about trying to get some of our processes or services online?
I did notice.
Oh, go ahead, Nikki.
Well, I think we were going in the same direction. I noticed a few questions in the chat. A lot of concern about how do you ensure patient privacy in providing the online services, and what platforms is everyone using to fulfill their their online or remote services while everything is closed and everyone's working off-site.
We've been helping, at Roswell, here at Roswell, our pharmacist asked for the resource center staff to help them set up online or set up virtual consultations with new chemo patients. And so what the resource center staff's been doing is helping people get on to Zoom and be able to either, if they choose to have a Zoom meeting with their pharmacist, or the pharmacist can simply call them on the phone. So I know that's what we've been working on here. Anybody else?
It looks like Maritza Nassif has something they'd like to say.
Hi, I'm on the call from Dana-Farber, and Pat Stahl, our senior manager, is also on here. We have been doing virtual workshops since April, and we've been using Zoom as our platform. We worked with our privacy office to make sure that we were, following compliance, and what we came up with was that only the facilitator of the workshop would be the person showing their camera. So when participants join, they can't share their video, but they are able to speak so that it can still be discussion based. So we have workshops in different topics like spirituality. There's nutrition workshops being held by our Zakem Center. So we've really worked on our online programming. It's also, we use the webinar function. So there's obviously a password. You could do pre-registration where only the people who sign up get the link. And then we always have 2 hosts to be able to monitor the workshop as it's going. There was a lot of thought that went into what workshops we're offering, and we continue to monitor that. I think the biggest thing for us has been getting the word out there, which is what a lot of you are saying. It is posted on our external site, but I don't think it's clear to patients that that is how we have, transitioned from an in-person resource center to a remote option. So we're still working on those issues as well.
Has anybody had any issues with using Zoom or Microsoft Teams or any of these others where the patients are working with are seniors or don't have access to this kind of equipment? Has that been something that anybody has run into? Like I said, what we're doing here is if the patient is unfamiliar, doesn't have the equipment, doesn't want to use Zoom, the pharmacists are just calling them on their regular phone number. All right. Any other questions from anyone on? It looks like Zoom and Microsoft Teams are kind of the number 1 and 2 platforms that people are using. Has anybody had any other issues with privacy if people are on Zoom? Has that come up? I think Maritza made a good point of only the facilitators or the hosts using the video chat. And can people choose their names that pop up? Maritza, is that something? Okay, they can. Okay, so they can choose the amount of privacy that they want when they're using Zoom.
We have a comment in chat from Rainia. I'm sorry if I'm not pronouncing your name correctly. They say that you can set Zoom room more private. And so for focus groups, patients would get a link and an ID, and that way other patients can't see the names or phone numbers. So it would just be, it sounds like it would just be their randomly provided ID that shows up instead of their name or phone number like we're seeing here on this call.
I know somebody from our team here, Carol Nottingham, is on the call, and she has been somebody that's been making phone calls to our patients to help get them on Zoom virtual meetings with our pharmacists. So Carol, is there anything you can share as people had difficulty? Are they comfortable with this process?
Can you hear me?
Yep, go ahead, Carol.
Oh, great. Yes, I just posted something in the group chat. What I'm finding is about 50% of our patients are willing to try the virtual medium for our pharmacy contacts. And the 50% who don't, it seems to be usually a concern about how will I navigate that. I know that our institution is really good at putting up virtual visit instructions right on our website. So I offer to guide them through it verbally, or I send them the link on how to do that. I also know that some of our demographics in terms of health literacy, we like to assume that everybody has a smartphone, but that's not the case. So people sometimes are not able to do that just because they don't have access to a working computer or they don't have a smartphone. I can tell you, though, a lot of the patients who have been able to navigate it really do like that virtual contact from the pharmacist. And once they get through their first one, they're more than welcome to do more. I should say they're more welcoming to do more of those contacts. It makes me think a little bit more about our resource center and whether or not virtual contacts will be a way that we could also service patients.
Thanks, Carol. Can I ask anybody out there if anyone's resource centers also have a wig, complimentary wig program, and if anybody has been able to still get patients wigs or hats or things that they need during the shutdown. Is there anybody out there that would like to share anything about their wig program? And I know Martha is on the call. Martha, do you want to share how that's been going in our resource center to see if anyone else has had similar experiences?
Hi, everybody. We have a resource center that is obviously closed, and we've actually turned it into a staff sanctuary. So it's been able to provide respite time for staff that are our frontline workers. So it's really been a beautiful transition. But we are, as Megan said, in the plans of being able to open and to close the sanctuary. We're looking for alternative space in the hospital. And then when we reopen, we were going to do the wigs with, non-contact. So they would not be trying them on. They would be trying them on a mannequin. In the meantime, we've been using successfully the website and then mailing them their wigs. And am I forgetting anything, Megan?
No, I think that's it. And I think we've had some really good feedback on how it's working. I'm just really pleased that it's something we didn't have to stop doing. And I think our team was really good at figuring out how can we get these people wigs and how can we keep them happy and content during this time. I see somebody else also is doing wig fittings virtually with the TLC catalog. And then again, they're also shipping directly to the patient's home. Susan Chandler says our wig center is open 1 day a week by appointment only. Thanks, Susan. That's something that we have to look into in our resource center. We've always let people stop in, but we're not going to be able to do that anymore. So must call provided staff with cell phones so she can return calls from her home. Yep, we're doing that too. So thanks, Susan. That's something that we're definitely going to be looking into as well. Let's see if there's any other comments.
I was going to say that it looks like ACS is also closing down their in-person services, but moving everything virtually and online, and their services are still available. They will just be mailed a wig instead of being able to come in and physically kind of inspect it and choose from there.
I know it's nice that we don't have to stop that program. It may not be, we may not be able to spend an hour with them helping them pick out the perfect wig or hat, but it's really nice that we cannot just forget that people need this during this time.
Perfect. So
I have a comment about the wig. So we used to get the TLC vouchers for through ACS, but we heard that they were doing away with that at the end of this month, so that you won't be getting any vouchers and ACS wouldn't be providing any fundings for wigs. So are there different funding that y'all are getting for these wigs, or just using the TLC catalog and the patients are paying at that price?
We're really fortunate, I have to say. I feel very lucky at Roswell Park. We get quite a good budget from our Alliance group. Money is raised. It's kind of a motivating thing to raise money to help us get the wigs. So we are able to buy our wigs due to donations received into our Alliance. In fact, we were also able to add hats and sleep caps to the program as well. We used to also get wigs from the ACS, but not so much anymore. I think that kind of slowed down in our area as well. Anybody else have where they get their funding for the wig program?
We actually, most of our wigs are actually donated, and we work with some different hairstylists in the community that then clean our wigs and style them for us. So that's actually where we get most of them. But some patients aren't comfortable with that, and I don't know how they're going to feel moving forward, you know, having donated wigs, even though they have been cleaned and all of that. So and we don't know what we're going to do. We're coming back on Monday, and at this point, we're not going to be offering our wigs at this point, still just trying to figure it out. But now that we don't have our TLC vouchers, that's also a big problem for us. So I'm trying to figure out ways to get our wig program up and running sooner. So we do have, like, all of our wigs are inventory, and pictures are taken on mannequins, and patients look through PowerPoints and then choose what they want to pull out of our stock. But our problem, the wigs fit so differently on an actual person than they do on a mannequin. Yes, and that's where I am, you know, just trying to figure out what to do. And Carol, I see your question. So we work with, so our wigs are just cleaned by people in the community. So hairstylists will actually, I'll bring all of our donated wigs to them, they'll clean them, and then I'll go and pick them back up. So that's how they're cleaned. It's not done in-house.
Yeah, we're trying to figure out the best way to disinfect wigs, because in the past, if somebody, we don't take returns of wigs, obviously, but in a time where they can't be there to choose their own, we would like to offer that, but without having a strong sense of how to disinfect them, I'm not really comfortable with that right now. I do have our infection control team looking into it, but we've never had a strong sense of how we can really disinfect the wigs safely in order to share them. So I think that's an issue we all go through. Can I ask, is anybody, whether it's a wig program or just a learning resource center, is space an issue? I know, Nina, were you talking about you're out in the hallway, so you're kind of a very open space, which presents its own challenges. Our challenge is that we're a tiny little room that we have, that we used to be busting with people, and now we're not going to be able to. So I'm wondering if anybody else has that challenge of a small space and trying to keep social distance. What size are people's resource centers? Anybody like to share? Oh, Martha, do you have your hand up?
I did. I just had a question about Annalise. What hospital are you from where you take the donated wigs?
I'm at Levine Cancer Institute in Charlotte.
Okay. Okay, great. Thank you.
Hi, it's Lorena Garrell from Cancer Care Manitoba. I was trying to raise my hand. I'm not quite sure how this works, but
oh, well, you're good now, so we're glad to have you.
Okay. Sorry, I tried raising it a few times and then I finally just unmuted. Just a couple things I was going to share. We have 2 wig rooms, and during COVID, of course, we were completely shut down. And so what we had done short term is we have been mailing out, we have the soft cotton, they're like, you know, the nightcaps, but we do them in blacks and grays and have them sewn with the material. So we've been mailing those out. They're cleaned first through laundry services, and then they're mailed out in Ziploc bags to new patients only. We've probably sent out, since we opened that up, about 30 over the last couple of weeks. So it's definitely meeting a need. I joined a little bit late, so I just caught the last part of the discussion on wake services. But I'm just going to echo what other people were saying. We're fortunate here. We get funding through our Cancer Care Manitoba Foundation, and we apply for a grant every year. Our program is a combination of we purchase some new wigs, and then we get donated wigs. Infection Control Services here has a process we follow where those wigs with the local training salon are laundered there, and they use per diem to disinfect them. So with a combination of that with water in the machine, and then they're just laid out to dry. And that's how we sanitize the wigs. Whereas the headwear goes through laundry services through the hospital. But again, we have funding each year that we applied for, and it allows for you know, any costs. With the hair salon, that's a partnership, so we pay nothing. They're doing that as sort of a community support piece. But we are struggling with how to go about offering wigs again to patients because of the fittings, and worrying about you know, any contamination. If our wigs are on display and then people might choose 3 to try on, and then the one they choose is the one they take, and typically they're put back onto the mannequin heads, which isn't going to work right now, of course. So I don't know if anybody else has any comments that they can share around that.
It looks like Nina has her hand raised.
Oh, honest, it wasn't about wigs. It was back to the other question about what are people doing with their space. So I can't answer anything about wigs. I can hold my comment until that discussion's finished.
Okay, Lisa Horton has her hands raised. Lisa? Is Lisa here? Okay.
No, here I am, sorry. I was going to talk about, like Nina, I was going to comment on the space issue, but regarding the wigs, as I mentioned earlier, we've suspended the program. We have done a couple virtuals, but it is very time consuming. And with reduced staff and reduced hours, that's been a little challenging. So we're just going to wait and work with infection prevention, our team, to determine when we can resume that service and what that looks like. Our funding is provided through donations. We do buy new wigs with those donated funds that we're able to provide for patients. But back to the space issue.
Oh, good. Yes, Lisa.
Our concern is our upper management and our emergency prevention folks are looking at our now closed library and seeing that as a space that they can use. And I wonder if anybody else is having that. Like, I'm happy to jump in and provide our space for the short term, but my concern is that we may lose that space because they're trying to make it a waiting room so that they can do better social distancing and use our space. So my concern is giving it up and not being able to get it back.
That's always a good point, because once you lose it, it's, not having it in your hands again. And Nina, you had something to say on the space as well, didn't you?
Yeah, so like I mentioned before, we're in a very wide open space, which definitely has its advantages because there is a lot of room there. But we also have a second resource center, which is a very tiny room, but it's self-service. So we haven't even gotten into those discussions yet. Would that be okay to, right now the pamphlets are out, but that does have a door and the door is closed. If it's self-service, would we even be allowed to keep that little room open because everybody's going to be touching all the pamphlets? And as far as what the person just before me, I'm sorry I didn't get your name, about somebody using the space, I guess that's always a concern. Our space is very prime real estate. I mean, it's a beautiful area, absolutely beautiful, and it's been empty now since mid-March, so I'm hoping that we're able to reopen, but you never know what others are thinking. But it's a concern. And I was just wondering, what are people doing about like self-service areas such as what we have?
There's been a lot of comments in the group chat about the loading practices, loaning libraries, materials, touching books, accepting and distributing donations. So it does seem to be something that we're all struggling with right now. Where before people could come in and touch things, grab things, move on, but now It says here, Kathy Jenkins at MD Anderson, our book lending has been put on hold and extended out for many months. They're following best practices on quarantining return items from the Medical Library Association. Someone else also says that they're not accepting donations of knitted caps, which again, that's something we're gonna have to look into way down the line. And Lisa Scheib, sorry if I said that wrong, is they're looking into an e-library. So it is something that I believe we're all struggling with, how to distribute materials and keep them safe. Thank you for the suggestion, Kathy Jenkins, about the quarantine returning items from the Medical Library Association. I think that might be helpful for a lot of people for things that get returned. Or we also talked earlier, and see if anyone is talking about along these lines of not having our materials or products being self-served, to only have the staff touch them and not have many people. Is that something anyone else is considering? Or anybody else have any ideas on any loan programs or material distribution that they have?
I'm wondering if, would Kathy be willing to talk a little bit more about what the guidance is from MLA in terms of handling materials that are returned before we move on?
Kathy mentioned in the chat here that the MLA website has the quarantine recommendations. So that might be something, so that's a good suggestion for everybody. If anyone else would like to get more information on this, to check out the Medical Library Association website, and they do have quarantine recommendations. So I think that's a great resource for us. Thank you, Kathy. It says she also put in the group chat that books returned should be wiped down with the disinfectant wipes and quarantined for 14 days. Oh, okay. That is something that will have to be, it's a long time, but that is really good information to have.
It looks like Martha has her hand raised. Go ahead, Martha.
Hi, we were just talking about how to best disseminate the materials that you may have in the Resource Center to your patients that are needing specific information about their specific cancer, or talking to their children about cancer, or managing a side effect. Our Resource Center at any given time, while we're small, we're mighty, and we could have, prior to COVID, could have had 15 people in the room at one time and 4 or 5 staff and volunteers at one time. So we get to be a very busy place, very bustling. So now we've been limited by our hospital to only have 6 people in the room to be able to safely maintain social distancing. So with that said, we're being careful not to have too many staff. Therefore, we don't have enough room for patients to come in. But also, I think it's going to really look something like this. The patient walks in, they've already been screened at the door, they're wearing their procedure mask that's been given to them at the hospital door, they've taken off their cotton handmade mask from home, and they've sanitized their hands, and now they're in the Resource Center looking for information. When they come in, they wash their hands, and then because there are only going to be very few of them allowed, 6 total people in the room at one time, I think it's going to turn into and look like a very personalized service, welcoming them, offering them, telling them what we have, and finding out just what it is they're looking for. And then the staff and I know where everything is. We have beautiful folders that then we would go and collect the information that they need and give them a folder that they take and not have to return or bring anything back to us. So I think it's going to look like more of a personalized one-on-one type of service to really listen closely to what your patient needs, ask a lot of good questions, and figure out a way to send them on their way, because it can't be a place where they hang out anymore. They used to come in between procedures, and we loved that, and hopefully one day we'll get back to that. But more of a one-on-one, meeting their needs and pulling the information they need and then sending them on their way.
I noticed Julie Bulger also just posted a comment that she is a self-service resource center without a door as well. I think much what Nina was talking about. And she's been working there physically as much as possible, but she made a really good point that it's been appreciated to have a human presence, especially for the new patients. And I do think that's something we all miss. I think our resource centers, besides the great information and the wigs and the loans and all of the services we provide, I think something we all appreciate is that human connection. And I think it's something that we do miss, and that I would think everybody here is kind of anxious to get back to that a little bit. So I'm hoping that all these ideas we have to still connect is better than not connecting at all, because we don't know how long it's going to be until we can crowd a room or touch people again. So it's good to know that whatever human connection we can make is always appreciated, whether it be on the phone or be only 6 people in a room, however we can do that. I do know we're getting, so go ahead, Nikki.
Yeah, I'm curious to hear, for those centers that are looking to reopen their physical space, will you keep the same hours you had before everything kind of closed down? Will you be shortening those hours? Will you be closing at a certain point throughout the day to make sure there's a chance to clean everything? I'm just curious to hear kind of on that practical side, what other centers are looking at for when they do reopen. Or for those who have been open, have your hours changed? Have your cleaning practices changed? And what does that look like?
I think like I said, we're planning to open on June 8th. And I think Martha and I were talking, I think are going to lower our hours just a little bit to give us extra cleaning time before and after we open. So, and again, since we have to keep the numbers in there so low, we're only allowed to have 6 people in the room at a time. So we just wanted to build a little extra room on either end. I also just wanted to point out in the group chat here that Janet has posted a link from the University of Toronto that's got good cancer and COVID consumer health site. And Carol Nottingham from here, Roswell, that asked a question and kind of posted a comment. Is anyone sending links to people instead of materials, and does that seem to work a little bit better? And I also like this comment from Lisa Scheib here again. They have a form that patients can fill out regarding the information that they need, and a health educator gathers the info and either emails it to them or mails them directly the resources. So those are some great ideas on here that people are sharing. And we're about 5 minutes away from the time being up, so I just wanted to give a chance. Oh, Janet's got her hand raised. Before we go, Janet.
Hi, everybody. I actually had a question for Lisa about the form that she has. I wondered how patients and family find the form, and if she's had good uptake of it so far, because it sounds like a great idea. My only question about it really is how many people are accessing it and how do they find out about it?
Is Lisa there?
Yeah, I am. I had to move. Sorry. We have so many people in my house right now. So we have the physical form in the resource center, and we haven't closed, so we've been open. And so people can fill the form out that way. And I think it's on our website too. I'm not really certain, but that's really, there's not a great way for people to access the form right now online, although we're trying to update our website so that there's more helpful information. I'd be happy to share the form with anybody who would like it.
Yeah, I think that sounds like something that we're all interested in, Lisa. Thank you. That would be great if you could share that with us.
Sure, no problem.
Janet, did you have anything else? Is your hand still up?
No? If it is, I don't mean it to be.
Okay. So in our last few minutes here, does anybody have a question they'd like to put out quickly before we leave? Any more comments or questions that people would like to share? Kimberly Eslip also posted a comment that the Australian Library Association has a checklist for reopening libraries. Thank you, Kimberly, for sharing that. That could be a great resource. Gila from MD Anderson posted a comment that they have their Learning Resource Center's recommended resources online guide, and she included a link for that. Thank you for sharing that, Gila. Is there anybody else that would like to share anything before we go?
Lisa, it looks like you have your hand raised. Did you want to?
Yeah, I would. I just like to say, having been open through all of this, it was definitely challenging. And I'm only in the resource center 3 days a week for 4 hours. But I just want, it feels very different now than it did before, which I'm sure everybody knows. But just coming from somebody who's been through all of this.
Where are you from, Lisa, if I can ask?
Yeah, Seattle Cancer Care Alliance.
Oh, great, thank you.
Yeah, Lisa Horton is my manager. So just putting that out there, that I think once everybody sort of goes back, it's probably going to feel strange. So
I know the new normal, as we call it, correct?
Yeah, exactly. Yep.
Okay, so I want to thank everybody for joining us today and sharing your experiences. I think it's always good to know we're not alone and we're doing these things together. Thank you, all of those who shared excellent resources and ideas. And if anyone would like to keep this discussion going, please reach out to Niki and I, and we can kind of get a group chat going to continue talking. Because as Lisa just pointed out, this will be an ongoing process, and we're all going to feel a little strange when we get back.
Megan,
and I think
it looks like we have a request to run this again in a couple weeks, so we can bring
I
that
would
back
love
to,
that would be great.
on board to do that again.
Because I think it sounds like we're all kind of on the precipice of opening, or at least thinking about it. So I would love to revisit in a couple of weeks and kind of share where we have been and any experiences to help others. So thank you, everybody, for an excellent meeting, and I look forward to talking to you all again. Niki?
Yeah, I just want to let everybody know, if you're part of CPEN and you're interested, it sounds like we're gonna do this again in a few weeks, but also I don't think this conversation is really going to stop for quite a long time. And I just want to let you all know that if you're part of CPEN, or if you're interested in joining CPEN, we do have a Learning Resource Center special interest group, and we will be sending out an invite to everybody who is part of that special interest group for a call coming up here in the next month or two. And we can continue the conversation there as well. And we can talk about if we want it to be a phone call or through Zoom, but we can just keep these conversations going. And so if you're part of that special interest group, then you will know when the next calls will come up, and we would love to have you. And with that, I think our time is up for today, but thank you, everyone, for joining in and sharing all of your insights. Make sure, just keep an eye on your email for any information on upcoming CPEN Engagement Lounge topics, and for the next LRC Engagement Lounge that we'll have in a few weeks as well. I hope everyone stays safe, and we will chat later. Take care, everybody.
Thank you very much.
Bye, everybody.
Bye.